Lost in apps. Healthcare's cry for unity.
Good morning, everyone. Thank you for coming in these early hours. I would like to focus today my talk on one of the major problems of the healthcare industry, and this is fragmentation communication channels. But it's not just about the fragmentation communication channels in general. It's about who is suffering the most from this fragmentation. And many of us think about organizations, about event organizers, about professional communities that need to communicate, hospitals, clinics. But who is in the middle of everything? Let's discuss it. And who is suffering the most from the fragmentation? Let's look at that. Who is in the center of the universe? The healthcare professionals, right? And how they communicate. What are the channels? They have organizations where they work, like hospitals, clinics, pharmacies, any other organizations. They communicate in their professional communities, like societies, like professional associations. They communicate during the events like this one, right? They communicate in meeting, online and offline meetings, and of course with patients. And let's think, if they have a freedom of choice for their means of communications, for their application that they use. Let's analyze it. If someone is going to look from outside, it's a real mess because so many channels, so much information is flowing, and how our hero, the single healthcare professional, can handle everything. It's the real challenge because of the situation that they don't really have freedom of choice, which application to use. Let's look specifically how we communicate as healthcare professionals inside organizations. Each and every organization decides which application to use, right? Let's say, for example, Microsoft Teams. They decided to use Microsoft Teams, and what is happening? All professionals, all employees, all service providers must align, right? They must use this application. And let's say if they work in several clinics, in several hospitals, each one of them decides for themselves what to use and who should align the healthcare professional with another profile, another password, probably another application, and so on. When we ask organizations, do you really think that your solutions provide the best possible communication option? So they say, yes, for our organization, it's okay, probably. Maybe we would like to have something better, but it's okay. What about your professionals? How they communicate? Do they use your application also outside of your organizations? Are they happy with that? You know, we need to organize our own clinic, our own hospitals. We don't need to care about, they decide what they use in other places. And this is usually the case, unfortunately. Let's look further. What about communities? Every professional belongs to some professional association, right, or society, or network, or group of professionals. How do they communicate there? How they choose their means of communication? They have platforms, right? Some organizations choose to communicate via emails. Some create network in social media. Some create WhatsApp groups, and so on. Who doesn't have a choice to decide which means of communication to use? The healthcare professional, who is actually carrying all the workload on his or her shoulders, right? Let's go further. And it's very interesting because we are at the event, an excellent event, but how do we communicate during the events? And every healthcare professional attends several events during a year, not just one. And what happens? We have a separate mobile application or a platform that serves this event for networking, for agenda, for everything. And what happens 2 days after the event? We forget about the application. We need another one because we go to another event. And after all, we have dozens of different applications. Who decides which application to use? Healthcare professionals? Not. Every event organizer. And this is another huge fragmentation and inefficiency. Let's go further. Meetings. we need to communicate during professional meetings, online and offline. And what do we use? Okay, we need to coordinate with our counterparts which application to use. Either Zoom, maybe Skype, maybe Microsoft Teams, maybe Google Meet, or any other application. It depends what the other part uses. Again, we need to align with many applications and tools which are available for our counterparts. We don't decide. So why is it happening? What could be done better? So in our opinion, in order to avoid this situation of being master juggler, because we have, as healthcare professionals, another challenge to treat the patients in the most efficient way. And let's think also about all other applications, not connected to communication, connected to new solutions that we see here, for example, AI solutions, VR, AR solutions. They emerge like mushrooms after rain, right? All the time. How we decide which one to use? We need to register. Usually they are standalone applications. They are not integrated in our workflows, right? And other varieties. So a lot of solutions and decisions that the healthcare professional need to take. We think that another solution should be present. And the solution is unified professional platforms. As for communication, we need to think in terms which channels of communications are available or needed for healthcare professionals, right? From this point of view, not what is needed for organization in the first place. So we know at least 5 channels of communications of healthcare professionals, and such platforms must include all these channels. Of course, they need to provide solutions also for organizations, for communities, for event organizers. But first of all, we need to focus on the single healthcare professional because they deliver the care and they are the most overloaded with all this flow of information. Medentee, in this case, decided to take this challenge. And after 3 years of development, we launched these days our application. This is, in our opinion, the first attempt to solve this problem. We believe that more attempts will come in the future, but we are, as a pioneers in this space, we believe that we can bring value to the industry because we are thinking in terms of communication channels of healthcare professionals, not of organizations. But exactly the opposite. The organization will align with healthcare professionals according to their convenience, not the other way around. So you are invited to our stand if you would like to know more how we solve this problem. But meanwhile, I would like to invite you to join the MedTech World community on our Medentee platform. We believe that after the event, you should have an opportunity to network efficiently, not just for this event, but also for all other events of MedTech World. And the community will give you the option to do this much more efficiently. Again, you are more than welcome to come to our stand. We will help you to get onboarded. I would like to give words to Dylan.
I just want to say a couple of pointers about Alex and Medentee. Communicating in healthcare has always been fragmented. I've worked in hospitals, I've worked in clinics, communicating between fellow healthcare practitioners, colleagues, as well as that sense of belonging in a community has always lacked. Medentee is there to change this norm. I've logged in on this platform, I've been using it for the past couple of weeks. It provides a unique experience to feel part of a community, the official MedTech World community on Medentee, which we've just actually launched this week, and hope to start communicating with you on the platform. See you there.
Thank you very much. You're more than welcome to join the community of MedTech World on the Medentee platform. And the most important, I invite you all to think in terms of healthcare professionals, how all of us, the whole industry, can simplify their lives in order to free themselves to give better care to patients, because this is the ultimate goal of all of us. Thank you very much for your attention.